Hello and welcome to a brand new episode of YA HALA Kuwait, where we delve into the latest insights across a variety of topics related to Kuwait with a big variety of guests and reports. I'm Rita Abdu, and this evening I'm joined by Daeed Lahwaichi. Good evening, Daeed.
Good evening, Rita. Thank you so much. And of course, welcome, dear viewers, to this brand new episode. So, dear viewers, our first guest for tonight is Dr. Vaishnavi Swaminathan, specialist endodontist and sedation provider. And our second is Anoud Al-Khalfan, a doll maker and a sculptor. And I can't wait to get to know more about them. So basically, before we get started, we have this report. So let's watch our first report for today on LOIC tournament. Welcome back, dear viewers, to the studio of YA HALA Kuwait. First of all, I would like to thank our crew for making all these beautiful reports and going out there to show us the spirit of Kuwait. So basically, I think our team and our guests today have something in common, which is precision, right? They have to be precise in making all these details and all these reports. And I guess when it comes to our guests, let's say Anoud or Dr. Vaishnavi, they also have to be precise in their work when it comes to doll making or craftsmanship. Right? And also the endodontist or dentistry in general, you need to be precise to finish all the details, either it's for the dolls or patients. So basically, I guess I would call it the art of precision. That's the title for today, I guess. What do you think?
I think that's a very great way to put it, Daeed. I didn't actually think of it like that, but it's very true, because with our guest, we're going to get to meet her and, of course, see her work, and it's very, very precise. And I think that's what makes her dolls very popular. And same thing, I think, applies to dentistry. You know, when you go to a dentist, you want their work to be perfect, because a smile is what everyone sees the first thing when they meet someone, right, Daeed?
Definitely. First impression is important, and it's something necessary, and it needs a lot of effort and details, and that's why precision was the key word here today. So basically, of course, we have got a lot to talk about here today, but of course, we have got this report, so stay with us, dear viewers. We'll be back after the report about Did You Know?
Stay tuned for the next guest.
Welcome back, dear viewers, to the studio of YA HALA Kuwait. And of course, we'd like to welcome our first guest of today, Dr. Vaishnavi, aka Dr. V, specialist endodontist and sedation provider. Welcome and good evening.
Thank you so much. Have a nice day. I'm so inspired and happy to be here today.
And I'm so happy as well to have you here and discuss the topic of this evening. So basically, let's get started with the inspiration part. So what inspired you actually to specialize in endodontics, and how did you develop an interest in sedation dentistry? This is interesting.
Yeah. So basically, when I completed my bachelor's in dentistry, something that urged me to choose endodontics is when I see a patient walk into the dental office with so much of pain, and so much pain that's unbearable, and when I've completed the treatment, like root canal is simple as just remove the nerve. So it's as simple as, unplug the socket from an electric socket, unplug it. So the patient goes with immediate gratification, and the pain is really gone. And when I see that, we really feel the pain of the patient, and when I see how they entered and how they exit, it's really rewarding. So that's one reason which asked me to choose endodontics as my field of dentistry. As you know, dental pain is the worst pain ever.
Definitely.
Yeah.
And I'm one of those guys who was always scared of visiting the dentist. But when I got to know more about the advancements and techs, the recent ones, I feel now more comfortable. And it's one of my favorite places to visit. Usually 6 months for cleaning and all these kind of things.
Exactly.
All right. So now let's talk about, like, how do you actually balance both roles in your practice? The field is huge, as you mentioned. So how do you balance it?
See, actually, being a sedation dentist and also being an endodontist, it works hand in hand. Because the sedation is usually provided for patients like you who have that phobia and that anxiety. Usually this anxiety increases the pain, And meanwhile, the pain also increases anxiety. So it goes hand in hand. So the first thing is to relax the patient. So when we feel the pulse of the patient and we know that this patient really needs sedation, or this patient could be handled right on the chair, that's it. So sedation really brings in so much of easiness for the dentist and the patient. It really relaxes them out, and they never want to stop using the sedation when they even come back for a regular procedure.
Is it because they're used to it, or it's like part of the I would say the project itself when you're working with someone?
Yeah.
Is it has to be used on the patients, or?
It is not mandatory to be used on every patient, but there are patients who have dental phobia, especially patients who've had an anxiety or traumatic attack right from the childhood. It's right there in the subconscious mind. So such patients are really traumatized from that procedure which they had before, you know. So the sedation kind of calms them down and they're totally relaxed, and it eases us also, and it eases the procedure, and the patient is not exhausted as well as the dentist.
Fair enough, doctor.
Yeah.
Now, I'm really curious about the misconceptions, if you will, and what are some of the most or common misconceptions about root canal treatments, to be specific?
The main misconception is the pain. Everybody says a root canal treatment is absolutely painful. It's not as painful as it is portrayed outside. With the amount of technological advancements and like the anesthesias and the sedation, it is really not painful, and also it is not multiple sitting anymore. We do have many procedures which we do in a single sitting, and multiple procedures, multiple sittings only if needed at times. And with the technological advancements, of course, like microscopes and all that which have come up, the procedure is surely short-lived these days. Yeah.
That's really interesting, and this will brings us to the next question regarding the text and all these kind of things. So, how has technology such as dental microscopes that you mentioned and also 3D imaging improved the outcomes of endodontic procedures?
The dental microscope is actually used to get a magnified version of the tooth. For example, when I'm looking at the tooth with a naked eye, it's more of a bird's eye view, but when I'm looking through the microscope, it has a magnification from 3 to up to 25 times. It's like when I'm using a 16 or a 25th magnification, it's like I'm literally sitting inside the tooth and digging it and cleaning every spot of it. So that way the success of the procedure is 100%. But the microscope alone cannot be used. We need 3D imaging like CBCTs, which helps us to find where the location is. For example, as the saying goes, the mind the eyes can't see what the mind doesn't know. So with the CBCT, we kind of locate the abnormality, and with the microscope, we are able to find out where it is and treat it right away with a less amount of time and easiness.
That's really interesting.
Yeah.
See, this is why now I'm like more comfortable visiting a dentist. And this is actually a message for all those who are like me. If you haven't been able to visit a dentist because you're scared, having that fear from the childhood, traumatized maybe, it's totally different from before. And that's why now it's easier, and you don't have to listen to what people say. You have to try it yourself, and then you will figure out that, it's nothing.
Exactly.
All right, so what types of sedation techniques do you use, and how do you determine which is best for a patient?
See, there are several types of sedations. Like number one is the inhalation, which was a mask which is placed over the nose, where the patient kind of inhales the gas. The second one is oral, where we give them a tablet which kind of sedates them, and the third is the IV, which we use in a hospital setting. But in a dental clinic setting, especially what I expertise is under the inhalation, which is a gas which has been provided. It's just a basic nitrous oxide, which is also called as a laughing gas, if somebody has to know. It's just inhaled along with oxygen, and it's absolutely safe, and that's what we use inside a clinic. And it is a portable small machine which could be used at ease, switched on and off as per the comfortability of the patient. And the basic advantage of it is within 3 minutes of stopping the gas, the patient can get back to normal. They could even go back home driving.
That's
so
really nice.
That's a great advantage of using
Do they
the
come in
sedation.
and they prefer something to be specific, like the laughing gas, if you will, or anything else? Do you have these type of patients?
The patients coming to a dental clinic usually comes with asking for the laughing gas, but as I said, the oral or the IV, which is used in a hospital setting, cannot be used in a dental clinic. It needs an anesthesiologist to be around. But what a dentist can provide is the inhalation dentistry. And of course, now with technology and social media, they are aware of a lot of things and they do come asking for it.
Oh, that's really interesting. And it brings us to another question, and it's connected, which is social media. Now, I noticed previously we spoke about something regarding reels, uploading stuff regarding your field. So how do you do all these things? How do you prepare for it? And what do you actually upload to the audience that follow you?
Yeah, so I usually do a lot of reels considering the present circumstance, but I usually make it informative for the patient and also funny in a way, and I don't involve my patients into it, but it is more informative and they know what to know and what to not be scared about. And the basic advantage of it is it helps me to motivate the next patient, because they don't know, they're clueless about a procedure, and it helps me to show them these videos and tell them that this is it, it's nothing big. And some testimonials from patients sometimes might also be helpful for the patient to be encouraged and motivated to get a positive experience in the
100%.
dental
I agree
setting.
on this, yes, 100%.
Yeah.
I'm with you with this point. So now let's talk about post-treatment, or maybe post-procedure, if you will. So how do you actually educate patients on post-treatments and care and recovery after the procedures?
See, after a root canal procedure, basically, the pain is not 100% as it used to be before, but I wouldn't say it is a 0 as well. So the pain is usually, the graph keeps going down. It might be a 50% the next day and nullified by in 2 days. But that is not all. After a root canal treatment, the basic thing is the tooth is devoid of nerve and blood supply. So it's like a dead structure right there, which is only functionally useful. In that way, the tooth is not strong enough. So you need to definitely cap that tooth. We usually say it as a crown in dental terms.
Oh, yes.
It comes in different varieties like ceramic, metal, zirconia. But the crown itself takes up all the load of your mastication and thereby preventing fracture of your tooth underneath, and thereby you don't have to extract the tooth. So that's the reason we did a root canal treatment, because we didn't want to do an extraction, right? So capping of the tooth is definitely necessary, and a 6-month checkup with the dentist is absolutely needed.
100%, yes. All right. So when it comes to now advices, what advice would you give to someone who is nervous about undergoing a root canal or sedation?
I usually feel the pulse of the patient. As they walk into the dental office, we know if they are anxious or not and how to calm them down. Some patients are very easy. You just speak to them, explain the procedure A to Z, and you keep talking to them. They're happy about it. Some patients don't want to be talked to. They don't want to be explained about the whole procedure. Such patients, as I said earlier, I usually show them these videos and testimonials of others. So when they know that a fellow patient similar to them has gone through the same thing and they feel really good right now, they are up to it. They take it up and they are fine with it.
All right. So communication is key, I guess. Communication is key to calm the patients or let them know about the procedures and all these kind of things. All right, so now let's talk about the advice for those who are wanting to be a dentist, or give you, I would say, those who would like to specialize in endodontics like you, or sedation dentistry to be specific in this field.
For aspiring dentists, the main advice that I would give is sky is the limit. Do not stop studying. Like once you're done with your bachelor's or your master's, that is not all it is. You need to keep updating yourself, especially in this digital era where we have lots of advancements in technology especially. The dentist or the endodontist or whatever specialist you are, you need to keep updating yourselves and get to know the recent advancements, and also experience and hands-on is all that you need to catch that field, and so that you're not left behind in the stream of the dentistry.
Well, you heard our doctor here, so basically follow these advices, and best of luck for all those who are becoming the future dentists.
Thank you so much, and I wish them all the best too. Thank you so much.
Thank you for being part of this interview, doctor.
Thank you so much.
All right, with that being said, we have reached the end of this interview with Dr. V or Vaishnavi, the specialist endodontist and sedation provider. For now, we have a report about heritage, so stay with us. We'll be back after the report.